Good morning, dear students. We are learning now in the lower limb. Our today's topic is anterior medial thigh. I hope you have gone through the previous material, and if there is any issue, please write to me. I can answer your concerns. So now, like upper limb, the lower limb has little differences. We have discussed in our organizational video, organization of the lower limb. And now let's see the anterior medial thigh region of the human thigh. So now these are the objectives, and we'll go over during this discussion the muscles, their action and nerve supply who are present in the anterior compartment of the thigh and the medial compartment of the thigh. Then we had a very important region here that is known as femoral triangle. We'll talk about that. And then we'll touch upon the arteries, veins, and nerves which are present in this anterior medial compartment of the thigh. Posterior thigh we'll be discussing in the next lecture. So now, as usual, like I always start my description, so I start with a cross section. So this cross section, you are looking at the skin, and under the skin we have superficial fascia. Superficial fascia is showing you a blue structure here, and that blue structure is the vein. So in upper limb, we learn about cephalic and basalic, but here there is a different name for that. And we call it long or great saphenous vein. Now this green circle is representing the deep fascia. And this includes all the muscles. And this has a name to it. In upper limb, we didn't name it. So here we call it fascia lata. And there you can see laterally there's a thickening which has been shown, and this thickening has a name. Because it has a function. And this thickened part of this we call it iliotibial tract. It's like a band, and we will understand it in our upcoming part of the things. So now inside this is the femoral region. So the bone in my thigh, it has a name, and we call it femur bone. And now there are these intermuscular septors which divide my thigh into three different distinct compartments. You can see that a big broad anterior compartment, then a medial compartment, and a posterior compartment. Each compartment has a group of muscles, and these muscles, they behave differently. So now this is my intermuscular septum. And anterior compartment, these muscles, what are they doing? Primarily, these muscles are for what? They are the extensors of my knee, and they have some contribution. I'm not saying chief contribution, some contribution in bringing the flexion of the hip. So these are the function of this group. And the nerve which innervates this group of muscle is the femoral nerve. So when we'll be talking about lower limb, we'll be talking about femoral nerve and sciatic nerve. So femoral nerve is a sole nerve which is responsible to supply, to control the muscles which we'll be learning in the anterior compartment of the thigh. In the medial compartment, the main action of this group of muscles, they are adductors of the hip. And the nerve which controls these adductors, that is obturator nerve. Now these nerves, from where they are coming? Yes, they are spinal nerves, but they are also coming from a plexus. And that plexus has a name which is in the lower segment. It corresponds to my lumbar vertebrae, so we call it lumbar plexus. And then for the posterior compartment, we have another plexus that is called the nerve which is coming from that plexus is the sacral plexus, and the nerve which is coming from there is the sciatic nerve. So now this is the posterior compartment, and they're doing opposite. What was the job of my anterior compartment muscles? They were flexors of the hip and extensor of the knee. And the chief function was knee extension. And now my posterior compartment muscle, which are also known as the hamstrings, their prime job is they are flexors of the knee and they are extensors of the hip. And their nerve is tibial nerve, which is one of the integral component of the sciatic nerve. We'll be talking in our next session about that. Now, you're looking at a stage dissection of a thigh, and there you're looking at the structures. This is the medial side and this is the lateral side. You can see that how the muscles, they have been organized against this bone, which is called as the femur bone. And look at, you always ask how we differentiate an artery from a vein. You can see that the thickness of the wall, and look at the thickness of this wall. The lumen is full because of this blood clot, and this is the superficial vein. So this is under the skin, I have superficial fascia, and there you are looking at the deep fascia. I hope you're good with that. And these are the different muscle groups which we have just discussed a little while. Let's try to figure it out. So yes, you're right. This is my anterior compartment. This looks to me more of the medial compartment, and this one is the posterior. You can see yourselves. These are the septors which are dividing, which acts as a divider, and they help us to understand. So now you can see here the same image has been transformed into a picture, and you're looking at the different area. You can read it yourself. Now let's talk about this bone, which is the prime bone, which is present in my thigh, and we call it femur. Femur bone has a head, it has these pits, there is a neck. Guys, this femur bone we have learned in your lab session, so I'll go over quickly. I'll just label it fast so we can understand. These are the trochanter's, these are the greater trochanter, and this one is the lesser trochanter. And these are different from the tubercles which we have learned for the humerus. And there you can see on the anterior aspect, there is intertrochanteric line, a line between the two trochanters. And on the posterior aspect, we have intertrochanteric crest. So these are just for different. Can you see there's a fossa here? And that fossa has a name, we call it trochanteric fossa. And now these are certain lines, they have their names. And now this is a rough area on the posterior aspect of the humerus shaft, upper part, proximal humerus, we call it gluteal tuberosity. And this is the shaft part of the humerus. This is the linea aspera having its two lips. And then these are my medial and lateral. What are these? Supracondylar lines, because they are above to these condyles. So this is the posterior surface, it has another name, we call it popliteal surface. So these are the tubercles, they are used for attachment of one of the medial compartment muscle we'll be looking at. So this is called adductor tubercle because it's designated for the attachment of one of the major adductors of our body. And now this surface, front of the femur, lower part, this surface is designed to articulate with a bone called the patella bone. So patella bone articulate with this surface of the femur. Now this part, it's the condyle. So you are looking at the lateral condyle from the frontal view and the lateral condyle from posterior view. And then this is above to that. So what should be the name? Lateral epicondyle. Above to condyle, epicondyle. And then who this should be? If this is lateral, this should be medial. So medial condyle, and then we'll be having intercondylar fossa, a dip between the two condyles. And now this was my lateral epicondyle. So what do you think? Yes, this is my medial epicondyle. Are we good with that? Any issue? So now let's come back to the anterior thigh. First we'll talk about anterior, then we'll talk about the medial thigh. So we know about this. This is the innominate bone or the coxal bone. In the normal language, we call it hip bone. And they are looking at the sacrum, the lower lumbar vertebrae, the proximal femur, the distal femur, and the upper tibia and fibula. So these are the bones. Let's quickly go over the anterior compartment. We know about it. The prime job of the group of muscles who are present in this area, their job is to extend the knee joint. And one of them is helpful in bringing flexion where at the hip joint. And their nerve is femoral nerve. The root value is L234. You know, it's different from the brachial plexus where we have things with C1, C4, C5, C6, and you know, vice versa. But here this is the lower segment, so their names are different. So now this green band, which extends from where? Which extends from my anterior superior iliac spine to a tubercle here, which is on the pubis bone. So we call it inguinal ligament. Actually, this is the lower free part of our abdominal muscle, which is the external oblique muscle. And we'll be talking in detail later part. Now, let's talk about the anterior compartment muscles, and these are also known as quadriceps muscles. Quadra means four. So now let's start going layer by layer. The innermost, right in front, middle of shaft of my femur, and that is my vastus intermedius muscle. And then medial to that, another vastus, and we call it vastus medialis. And then this is down, you're looking at the patella bone, which is just present, we just talk about that. So now lateral to intermedius, I have the vastus lateralis, very good. So now this is a muscle. If I remove this, can you see that vastus intermedius, vastus medialis, vastus lateralis, they are coming from the femur, front part of the shaft, proximal and the lower femur, and they are going down. And they are only crossing when they will become a tendon, they will come and attach here. So they are crossing this joint, and this is how they are helping as the strong extensors of my knee. But now look at this muscle. It also crosses the hip joint as well as it crosses the knee joint. So this muscle is straight. Look at, and it is having fibers, they are arranged. It's called bipennate muscle. This is called rectus femoris. Rectus means straight. Femoris because it's present in the femoral region. Now this muscle, it's one of the strong extensor of the knee, but this is also, because it's crossing this joint, so it is helping in flexion, bringing flexion at this joint. But this is not a great flexion. So it also flexes thigh at the hip joint. Now all quadricep muscles, they become one and they transform into one tendon. That is called quadricep tendon. That includes patella. And quadricep tendon, it becomes, when it's reaching to the upper tibia, the name has changed. Because it's going from patella, so we call it patellar ligament, ligamentum patelli. That's the name. And now, if we tap here, we can look for what? Reflexes. So we elicit what? The integrity of spinal cord level, L3 and L4. If I tap here, this muscle will contract. So this contraction indicates to me that L3 and L4 level of my spinal cord, it's fine, it's working. So we are using this type of testing for evaluation of different segments of the spinal cord. That is very commonly being done. So this tendon, as we said, is being attached to a raised area, a tubercle, a tuberosity on the upper tibia, that's called tibial tuberosity. Now, there is another muscle, you can see it just cross over, it wraps over. It starts its journey laterally from anterior superior iliac spine, and it whirls around and it goes to the medial side of upper part of the tibia bone. This muscle is called sartorius. Now sartorius, as it crosses the hip joint and it crosses the knee joint. So it is basically a flexor of both of these joints, but this is a weak one. This is not a strong muscle. Now there is another tiny muscle, which is present in the anterior lateral aspect of my thigh, and this muscle has a very specific name. We call it tensor fascia lata. Its job is this. It has to tense something which is fascia lata. What is fascia lata? We talk about it. This is the name given to the deep fascia of my thigh. So the job of this muscle is to tense that, to stretch that fascia lata or the deep fascia of my thigh, and then it extends from here, and it's basically what it does. It's to lower segment of this, there's a band. We talk about a thickening in the deep fascia, and we given it a name for that. We call it iliotibial tract, and it stabilizes my knee while we are extending the knee goes in extension. At that time, it is helpful for stabilizing the knee. Let's put it here. So there you are looking at what? This green band, which is being shown in the first slide as a thickening. That is the iliotibial tract. Who makes it? We will be talking when we're talking about the gluteal muscles. And now this iliotibial tract or band, it goes to the upper tibia to be attached on the lateral side, upper aspect of the. So this is how it goes and get attached. Now you can see a nerve which comes from my sacrum, goes behind my hip bone, leaves this pelvic cavity through this greater sciatic foramina, and going behind the ala of my ilium, coxal bone, and it's coming front and supplying my, which muscle is this? Tensor fascia lata. This is coming superior to someone, so we name it. It's passing through the gluteal region, so the name is superior gluteal nerve, and that is a specific nerve which is supplying to this muscle. This muscle is present in the anterior compartment, anterior lateral compartment, but its nerve supply is not following the pattern of this compartment. It has a different supply which is coming from the superior gluteal nerve, and the superior gluteal nerve is coming from my sacral plexus. And the job of this muscle is only to stretch this band, and it is a very strong band, and it is helpful in the lateral stability when of what? Of knee joint when it is in extended format. I hope this point is clear to you. Now you're looking at another nerve, a huge nerve which passes under the inguinal ligament. This is the main nerve of my anterior compartment of the thigh, and this nerve has been given a name. We have talked about it. It's the femoral nerve, and you can look at its various branches, and they are designated to supply the muscles which are present in my anterior thigh region. And we know these quadriceps, sartorius, all of them, their nerve supply is that. After supplying these muscles, this nerve continues as a sensory branch, and we call that sensory branch as the saphenous nerve. So now we are looking at further from the ala of my iliac fossa. I have a muscle called iliacus, and there is another muscle which is coming from my lumbar vertebrae, and that is the psoas major. Guys, we pronounce it with P. So this is, so together they are forming iliopsoas, and they are attached to the lesser trochanter of the femur. And now this is what the pubis bone, and this is what the ischium, and this is the shaft of the femur or femur. And now this is the tibia. We are good with that. And this is, we talk about that. That's the inguinal ligament. And now let's talk about the medial compartment. So in the medial compartment, who will be dealing at? Will be dealing with the adductors. Adductors of whom? Adductors of my hip joint. So we all know what is adduction. So now their nerve is obturator nerve. You might ask me, is there a typo? When I was typing femoral nerve, I wrote L234. When I'm writing obturator nerve, I'm writing L234. What's that? We need to learn about. So let's take the muscle. The first muscle of my medial compartment, this small band, we call it pectineus. So this is the pectineus muscle, and it has little role in flexion of the thigh at the hip. And then there is another muscle which is going down. That is my adductor brevis muscle. So these are the adductors. And then this was short, this is longer than this, so we call it adductor longus. And then what it does, other than bringing adduction, because when this muscle will stretch, it bring the whole limb towards the body, towards the median plane. That's called adduction. It also does a role in medial rotation of the thigh at the hip joint. And then after that, a huge muscle which covers this whole gap, that is called adductor magnus. Guys, this adductor magnus muscle has two components. One part of it is, which is attached to this tubercle, adductor tubercle, that is the adductor part. And another part of it, which is present with the posterior compartment muscle, those are the hamstring, so that is the hamstring part. Adductor part is working as an adductor, hamstring part is behaving like hamstring. And what was the role of the hamstring? They were the flexors of your knee. So the part of the adductor part of my adductor magnus, its nerve supply is being derived from where? From the obturator nerve. And the hamstring part, its nerve supply is from the nerve of the posterior compartment or the hamstring compartment, and that is a tibial. That we need to understand. This is something similar to what we learn about flexor digitorum profundus. And guys, we love those things which has dual supply, which has to do something extra. So don't ignore this muscle. So it is also helping. So it is medial rotator plus adductor. Medial rotator plus what medial rotation? It rotates the thigh medially at the hip, both of them, adductor longus and adductor magnus. But their prime job is they are the adductors of my hip joint. That point has to be very clear. Now the last partner of this group, and that is the gracilis. How I learned gracilis from the word gracious. So this gracilis muscle, it lies most medially. Guys, this muscle is not a very strong adductor, but this muscle is very useful. In so many special works, when we are harvesting, when we need to do some flaps, when we are doing some plastic surgery procedure, we use this gracilis muscle for harvesting purposes, or for, we can shift, that's a detailed part, but at least you should know that this muscle, if we can cut it from here, we can use it for other purposes, for interposition and so many other surgical intervention. So this muscle can be used for harvesting purposes in plastic surgery work, when we are doing some reconstructive work. And this gracilis bringing some kind of adduction, but it also helps. It's also a flexor of the knee joint. Now, we are looking at the main artery of my thigh, and this main artery of the thigh is known as the femoral artery. We know about the femoral artery is the continuation of what? External iliac artery. External iliac artery is coming from where? Common iliac artery. And common iliac artery is coming from where? Abdominal aorta. And abdominal aorta is what is originally it was thoracic aorta. And then from where it was coming, it was, if I take the journey from the left ventricle of my heart, I have arch of aorta. Arch of aorta become thoracic aorta. Thoracic aorta, when it passes through the diaphragm, we change its name to abdominal aorta. When it reaches to the fourth lumbar vertebrae, it divides into two common iliacs. These two common iliacs, when they reach near to the pelvis, one goes inside the pelvis, supply there, we call it internal iliac artery. And one which has to supply the lower limb, that is called external iliac artery. This external iliac artery, the moment it passes under the inguinal ligament, its name has changed. So this is the continuation, the termination of this. So now when it passes under the inguinal ligament, we call it femoral artery because it's present in the femoral region. Now you can see it's coming down all the way. Guys, there is an opening. Where is that? I cannot see it. So there you can see. Now this opening in the adductor magnus, so we call it adductor hiatus. Hiatus means opening. So femoral artery passes through adductor hiatus. And the moment it passes, it reaches on the back of my knee joint. And this region where it reaches, that is the popliteal region. So its name changes from femoral to popliteal artery. And that is behind the knee in the popliteal fossa. It's something similar to my cubital fossa. And now this is the adductor hiatus. And look at its deep branch, which is coming from the femoral. It's the counterpart. Same we learn. Brachial artery was giving what? Arteria. What was the name of that artery? Profunda brachii. And this one, deep artery of the thigh, profunda femoris. Excellent. So this is the deep artery, and you can see it's supplying the deeper structures which are present in this compartment, medial compartment of my thigh, and the deep structures, both anterior and medial parts. So now, can you see that? It terminates into these four. 1, 2, 3, 4. Can you see all of them? And they are doing what? Guys, they find holes, they perforate this muscle. Guys, there is a space outside. So if this muscle contracts, these arteries will not be occluded. Otherwise, if they were just piercing it, they could have been occluded. So you can see that there are clear-cut openings, and these arteries are named as perforating arteries. So that on the top, if I start, so 1, 2, 3, 4. So first, second, third, fourth perforating arteries, and they are coming from where? From profunda femoris artery. And now these are the perforating branches. And they are going where? To supply the posterior compartment, because posterior compartment don't have any specific artery. So femoral artery, in other words, I can say that it's supplying the anterior compartment, it's supplying the medial compartment, and it is also supplying the posterior compartment of what? Of my thigh. And now you can see that something is going from below upwards, passes through the same structure, adductor hiatus, and it is accompanied this artery, and that's my femoral vein. and it passes. The moment it goes under this inguinal ligament, now it's no more femoral vein. It's been called external iliac vein. It will be joining with the internal iliac vein, and they will be making common iliac vein. And two common iliac vein at fifth lumbar vertebrae join to form inferior vena cava, and this inferior vena cava, after passing through diaphragm, it enters into the right atrium of the heart. So now femoral vein, and that's the popliteal vein become femoral vein. It also passes through this adductor hiatus, and on its way it receives tributaries. Now, this is what? The most lateral structure. So my medial structure is vein, then I have artery, and then there is nerve. This nerve is called femoral nerve. That's the nerve of my anterior compartment of the thigh. You can see that it supplies the quadriceps, sartorius, and these muscles of the anterior compartment. And after doing so, it becomes, this is the continuation, and this is the sensory branch, because muscular supply is done and it has a name. We call it saphenous nerve, a branch of the femoral nerve. That's a sensory branch. Are we clear about the saphenous nerve? Good job. So now let's look at that. Another very important region in our thigh that we need to know about, that is called femoral triangle. So let's make its boundaries. So femoral triangle is really important. Why? We'll be looking at shortly. So the boundaries, we should not forget inguinal ligament. I hope everybody knows what is inguinal ligament. So superiorly, we have inguinal ligament. So where is the triangle? Because it said femoral triangle. Triangle in the femoral region. So there is my muscle. We all know. Yes. Can you name it? Yes. Sartorius. Laterally is what? Sartorius. And medially is what? Think of this color. Adductor longus. So if somebody asks me who makes the boundaries of femoral triangle, I can say very easily the base, or superiorly I have inguinal ligament. Laterally I have sartorius, and medially I have adductor longus. So now what are the muscles who are present, who are making the floor of this thing? I'm looking at iliopsoas, iliacus and psoas major. The iliopsoas, because here they are iliacus and psoas major, but here they are blended together. So we call them iliopsoas. So laterally we have iliopsoas muscle. Then we had pectineus muscle. And then we had, so these are the lateral one, these are the medial one. So if I have to memorize it, how I learn it, a very simple mnemonic, and that is A from here, from medial to lateral. A, P, P, I. A, P, P, I, adductor longus, pectineus, psoas, iliacus. And now, what are the contents? It's femoral triangle. Think of axilla. Everything was axillary, axillary, axillary. So here everything will be femoral, femoral, femoral. So let's put things here. So from lateral to medial, femoral nerve. Saphenous nerve, we talk about that. Then we had femoral artery. And then we had femoral vein. So VAN. Easy. VAN, van. From medial to lateral. What are these? These are the contents of my femoral triangle. Now, it's not that simple. Let's look at, these are the different parts of my inguinal ligament. It's like, moon, lune. So this is like a lune. So we call it lacunar ligament. It reflects on this pectinate line. We call it pectineal ligament. So inguinal ligament has a reflection that's called lacunar ligament, and then it is reflected as pectineal ligament. And now this is the lacunar. And now we know about the structure sartorius. We know about the structure adductor longus. Femoral nerve, we just saw it before. Femoral artery, it's profunda. Femoral vein. And what is that? Yes, great saphenous vein, long saphenous vein. It drains into, it's one of the tributary of my femoral vein. And can you see that? There is an empty space here. What is that empty space? We call it femoral canal. It's a small space, a small tubular structure. And it is empty, but it has a lymph node. And it is closed under normal situation. And this lymph node who lives here, it has a name to it. If you don't know it, it's okay. But this lymph node is called lymph node of colloquet. So now, how it comes? Just look at this underline, Navel. So, nerve, artery, vein, empty, lymph node. So, navel. Okay? So, this is a mnemonic which will help you to memorize these names. So, now the artery and vein and the canal, they are in a sleeve. In axilla, you learn about axillary sheath, and here we call it femoral sheath. Now, what is this? What is this arrow is showing to you? Guys, this femoral canal, as I told you, it's closed. But there are people, especially in women, this canal may become open. And once it opens, and if the intra-abdominal pressure increases, the content, any loop of intestine or any other part of the small intestine or abdominal cavity might pass through that from one cavity to another cavity. That's called hernia. And this is in the femoral region, so we call it femoral hernia. So femoral hernia, a loop of intestine may pass through this and we call it femoral hernia. Let's look at this in the next slide. So same concept here, same labels. Now we are looking at a section. This is a schematic section and we are looking at the axillary sheath. Femoral sheath is the counterpart. So this is the femoral sheath. We don't call it axillary sheath. And look at it. This is the femoral canal, vein, and femoral artery. So now the femoral nerve is outside the femoral sheath. This is the, yes, pectineus muscle. Good. And this one is iliopsoas. Yeah, you guys knows it. What happened? Increase in intra-abdominal pressure. So loop of intestine might pop down under the skin. Guys, have you seen people when they're doing workouts, when they are in gym, when they're lifting heavy weights, they are wearing those belts. Those belts are not for any fancy show. They are basically helping you because when we are lifting heavy weights, intra-abdominal pressure increases. So if, and this canal will have pressure and pressure and pressure, and this become weak, and there are possibilities that it passes out. So now, question is, why this femoral hernia is more common in women? Because they have a wider pelvis. Why they have a wider pelvis? Because they have to give birth. So for that reason, because of the having a wider pelvis, and then they have to apply force and pressure. So it's not every woman will have it. No. If this canal gets open, if that door is open, then there is a chance, not all the time. Maybe you're coughing, you are applying some pressure. So at that time, loop of intestine might pop it out. And when you press it, it can go back. But sometime if it got stuck here, then it becomes a surgical emergency. Loop of intestine got stuck here, then we have to perform a surgery. We have to release it, we have to push it back, and we have to repair the defect. That's the femoral hernia, and you need to know about that. So this is how the femoral hernia traverses to that, and that's the sac of the femoral hernia, and there is the neck of the femoral hernia. Are we good? So now let's look out about, we talk about the anterior compartment, and we talk about the quadriceps and sartorius. We talk about the medial compartment. We talk about the pectineus, brevis, longus, magnus, gracilis, and in the upper segment we talk about iliopsoas, and laterally we talk about tensor fascia lata, we talk about iliotibial tract. Then we said we have deep fascia, and deep fascia has a name. This is a unique one. So we call it fascia lata. Look at it. This is the fascia lata. It covers everything. And we said that this part become thick. There's a band, and this band is known as iliotibial tract, and it stabilizes my knee when I'm extending. So this is the one, and it's been attached to the upper part of my tibia bone. Are we good? So this is the fascia lata, how the fascia encloses all the structures which are present anteriorly, medially, and posteriorly in my thigh. Now, Facial lata has an opening. Why we need an opening? Because somebody has to go in. Who's that somebody? We just saw him. This is one. Run medially, and that's my long saphenous or great saphenous vein. Guys, this long saphenous and great saphenous vein has certain clinical significances, and you need to know about those. It's very frequently asked question. What are the clinical importance? This long saphenous vein is used for various centers use it for cardiac bypass surgery. And it is also used if someone has in a shock status. You cannot identify where the veins are. Veins usually get collapsed when we are dehydrated. So we can do a surgery. Where we do a surgery, I'll be showing in my next slide. Look at it. This is the long saphenous vein formed on the dorsum of the foot from the dorsal venous arch. It's a superficial vein. It goes all the way, passes through this opening and joining what? Femoral vein. And on its way, it receives numerous tributaries. Where are those? Look at them. So they all are going, entering into this, emptying. These are the superficial veins. And at the time of emergency, this is our medial malleolus. We can just make a small cut in the skin. We isolate this vein from here. This is called venesection. And we insert the tubings. We can draw blood. We can push medicine and everything. So what are the significances? If somebody asks you, the significances are, first of all, the venous drainage of the lower limb, primarily, as you have learned for the upper limb, we had a superficial veins and deep veins. And superficial veins are long saphenous and short saphenous veins. And then we have the vena committents, which are running across the major name veins, and they all are connected. And now, vena committents are surroundings of femoral vein, has its vena committents. So now, what are these? They accompany the deep arteries and are named accordingly. All veins of the lower limb ultimately drain into what? Femoral vein in the thigh. So we have vena committents below. So parts of the, so what is happening? We, as I said to you, we use this great saphenous vein as a graft during bypass surgery, and we may use it during venesection. I hope I have talked about all those structures which are present in the anterior compartment of the thigh, in the medial compartment of the thigh. We talk about the arteries, we talk about the veins, we talk about the utilities of the superficial vein, which is the long saphenous vein. We talk about the femoral triangle. Let's recap. Anterior compartment, we have quadriceps. Plus, we have sartorius. Anterolaterally, we have what? We have, yes, iliotibial tract. And that is connected to what? Tensor fascial lata muscle. And on top of it, we have iliopsoas muscle. So these are the anterior lateral compartment. And then medially, we have adductors. These adductors are pectineus, adductor brevis, adductor longus, adductor magnus, gracilis. I said adductor magnus has two parts, an adductor part and a hamstring part. Adductor part is innervated by nerve of the adductor compartment. Who's the nerve of adductor compartment? Obturator nerve. And the hamstring part, who innervates it? The nerve of the hamstring part. Hamstring part, posterior part. So that nerve is tibial part of the sciatic. Which one is the nerve of my anterior compartment of the thigh? That is the femoral. If I look at the root values for the femoral nerve and for the obturator nerve, both of them are L2, 3, 4. So it's similar. Why? We have to talk about that. After that, we talk about femoral triangle, and I told you, I have shown you the boundaries. We learned that superiorly we had inguinal ligament. What is inguinal ligament? Lower free border, lower free part of the external oblique muscle, which is an abdominal muscle, and it is connected to the anterior superior iliac spine and pubic tubercle. And medially, what do we have? We have adductor longus, and laterally, what do we have? We have sartorius muscle. And the apex is where these two muscles are crossing each other. And what are the contents? The most medial is a canal, which is called as femoral canal, which has a lymph node. Lateral to this canal, we have femoral vein. Then we have femoral artery. Then we have femoral nerve. And what are the muscles which are making the floor of this triangle? So we have adductor longus medially. Then we have pectineus. Then we have psoas. Then we have iliacus. Are we good? So guys, That completes the anterior medial compartment of the thigh. So I hope things are clear. If you have any question, please feel free to write me, and then I'll be able to answer you back for any question, any related item. Thank you very much.